Sige, let's start. Okay, let's talk about the basics of research first. And I think there are questions, meron mga questions kayo now that can be answered as we go on with our discussion. Okay? So, ba't ayaw mag-move? Okay, sige, let's talk about the stages of research. We have the following steps, class, that we are going to follow, no? For you to be able to complete your own research paper. Now, we are on the stage of selecting the problem and at the same time formulating your research title. Okay, we are again now on the selection of the problem and formulating the research title. After that class, we will start with our research proper. And the most important thing is for you to identify what type of research design are you going to utilize, and at the same time, the method that you are going to follow in order for you to gather your data. Okay? And then after that, if we have chosen class a descriptive study wherein you're going to make a questionnaire, then the construction and the validation of the questionnaire will take place. However, most likely this will happen on the second semester pa. Yung methodology na part, construction of a questionnaire, validating the questionnaire, and even validating the experimental procedure that you are going to do if ever experimental ang study ninyo, making of the interview guide in cases na your methodology na gagawin is interview, okay? And then, yung gathering procedure mismo, administering the questionnaire to the respondents, doing the interview, doing the actual experimentation will again take place on the second semester. So that also includes the collection, the analysis and interpretation of the collected data, and the brushing up of the whole paper. Second semester yan sila lahat. So we will just concentrate now with the selection, the finalizing of your title, and yung introduction and yung paper lang na methodology. Hindi siya gagawin na actual experimentation or actual data gathering procedure. Gagawin lang muna natin yung paper ninyo. So let's talk about formulating the research title since you are doing that now. Okay, now when you say formulating the research title, lang ha, kasi nag-move pala siya. Okay, again, when you say formulating the research title, it should not be long. Take note, your title should not be more than 20 words. However, the ideal length is actually not more than 15 words. But do not include in the counting yung mga function words na tinatawag like a, an, with, of. Do not include those. The, hindi din siya included. Let's just count the major words in your titles. And then again, the ideal is not more than 15. I'll show you an example later. Now, it should include the variables, the independent and the dependent variables, and it should give insight virtually on what the research is all about. Isahin ko siya later discuss when I give you an example. Kasi I don't know if you are still familiar with the independent and the dependent variables, but I'm assuming na you already had that lesson during your high school days since you were able to finish a research study. Now, aside from that, your title should not include the following. Dapat hindi na siya lagyan ng a study of, or an analysis of, or an investigation of, kasi lahat ng research class ay study and analysis din siya. Okay? Scientific names. Yeah, scientific names are included in the counting. Okay? Sige. And then it is not important also to include the date. When are you going to do your research? And at the same time, the local. It is not really necessary to include those things in your title because we have the so-called scope and delimitation in the introduction part of your paper. That is where we place the information like the date and the place of the conduct of research. Okay? So example of a research, an ideal research title, the predictive efficacy of academic preparation of radiologic technologies, para mas siya, related sa inyo, gawin natin itong pharmacist. Okay, ulit. The predictive efficacy of academic preparation of pharmacists on the licensure board exam. First, let's try to count how many words are included here in the title. So we have na-erase tanan. Ulitin ko na lang. So we have, let's count. We have 1. Sabi ko kanina, the is not included. 2. Of is not also included. So we have 3, 4, and then 5 for pharmacists, 6, 7, and 8. So again, this is not more than 15. Therefore, matawag natin siyang yes, ideal title siya. Okay, that's how you count the words class in your title. Do not include the function words. Okay, again, the ideal is not more than 15, but if it is more than 15, as long as hindi naman sumobra ng 20. Okay, next, the title should include both the independent and the dependent variable. So ano ba yung dalawang yan? When you say independent variable, we also call this the predictor variable. This is what we manipulate or we control in the study. So these are the only things that the researcher can control. Okay? Pwedeng i-change, pwedeng i-manipulate. And at the same time, predictor variable siya because manipulating these variables can result to a certain outcome. And the outcome for our quantitative research should be measurable. Okay? So just like in this title, what can predict the outcome is the academic preparation. That is why it is called the independent variable. And then the next question is, what is the outcome? We are going to manipulate or control this. What do I mean by control? Ito yung ina-identify natin in the study. Ano ba yung ginagawa during the academic preparation? So anong mga activities neto? So pwede tayong mamili kung ano yung i-include natin dito. So we can control that. And then again, ito yung predictor variable natin, and ano yung magiging outcome? Again, the result of the licensure board exam. So therefore, the dependent variable here is ito, the licensure board exam. That's how we identify the independent and the dependent variable. I'll show you more examples, and let's try to see if you can identify the independent and the dependent variables. I'll mag-load. Yung inopen ko. Bakit error? Wait lang kayo, nag-error siya. Nangyari. Kasi na connection. I have the copy of all the research in my Gmail kasi. Lang hanapin natin sa Gmail ko. Ang tagal naman mag-load. Sa the study nila Abner. Ay, bugay kayo. Ay, your internet connection is unstable. Kapait. Wait lang, let's be patient. Nasa school kasi ako. I cannot go home since I had a class from 1:30 to 4:30. Ay, ayaw niya. Ay, ayan na. For example, this one, though this is not a pharmacy research, but let's just try to look at this title and identify. But let me check if nasundan yung sinabi ko kanina na independent variable is our predictor variable and our dependent variable is the outcome. Okay? Sige, first question, what do you think is the independent variable here sa title nila? Medical fake news and fear-mongering during the COVID-19 pandemic. The impact on the vaccine confidence among the millennials. Yun kaya dyan yung independent variable, the predictor variable, the one that we can control in the study. Kasi pwede nating i-research and pagpilian kung ano yung i-include natin, example sa questionnaire. Ano kaya yung ating independent variable dito? Anyone? Sige. So looking at the title class, ang gusto nilang malaman, yung ano ito, they actually checked what are the medical fake news and yung mga fear-mongering circulating in the social medias, in the different social media platforms. And then they checked with their respondents whether there is an impact or like effect on the vaccine confidence ng mga respondents. So if we're going to identify the independent variable here is yung medical fake news and fear-mongering. Ang sino naman akong agi? Fear-mongering. Yan yung independent variable. Okay? Predictor variable siya. Anong ipapredict niya? Kung naniniwala ang respondents dito sa medical fake news and mga fear-mongering sa social media, ano ba yung magiging effect? Magkakaroon ba siya ng effect sa level of vaccine confidence? Okay? So kung tataas yung belief nila here, ano ba mangyayari sa vaccine confidence nila? Tataas din ba or bababa? So definitely this is the dependent variable. Kasi nakadepende yung vaccine confidence dito sa medical fake news and fear-mongering. Therefore, if you're asked what is the dependent variable, automatic this one. This is the DV, vaccine confidence. Okay? Sige, let's try some more kasi yung iba medyo na-confuse pa between independent and dependent variable. Let me look for other titles. Study. Kasi memorize ito. Ay, yung sa kanila, ano na lang. Ano ba pangalan niyo? Isabel Osano pala, Osano. Limutan ko tuloy. What's the title of their study? This one. Isabel Osano. You kasi memorize title na. Okay, this one is an experimental research. Again, experimental research. Blood sugar lowering activity of formulated tea from Nephelium lapacum rambutan leaves in alloxan-induced diabetic Swiss albino mice. Mahaba title nila. Without 1, 2, this is considered one word. 3, 4, 5, 6, 7, 8, 9, 10. That's considered one word. 11, 12, 13, 14. Pumasok pa. Okay. So we have no problem with this. Okay. Now, let me check if you can identify the independent and the dependent variables. Let's start with the dependent variable kasi mas madali siyang hanapin in the title. What do you think is the outcome here? Like when they conduct experiment, what's the outcome? What's the dependent variable? Okay. It has something to do with the blood sugar, right? Okay. Therefore, no outcome. If example, they give the rambutan to the mice, what are they going to measure? It's the blood sugar levels. That's the dependent variable. That's the dependent variable class, the blood sugar level. That's the outcome. Ito yung dependent sa ano. Ano yung ibibigay for experimental researches, the independent variables are the things that we administer, that the agents or substances that we administer sa ating subjects. Therefore, it's the formulated P from, di ko na sali yung scientific name masyadong haba. The Nephthallium lapatium rambutan leaves. Okay, so yan yung independent variable. Okay, predictor variable ito. Meaning if we are going to give this to our subject, the outcome most likely this one involves the blood sugar level. Therefore, if you're going to make a title for an experimental research, make sure that all of these are included. It has to be specific and clear in your title that you are giving this one, you are administering this drug agent, and through administering this, you can measure the dependent variable. So whatever pharmacologic action that you want to measure. Okay, so again, as long as everything is included in the title, then your title can be considered ideal. And as you can see, they no longer include a study of, an analysis of, or an investigation of. Do not include that in your title anymore. And at the same time, it is not really necessary to include the date and the place or the local of the study. So kaya nga sa study na ito, hindi naman nakalagay na sino ba itong mga radiologic technologists na ito, yung mga nag-work ba sa Jensen or saang lugar ba. Hindi na siya sinasali sa title. But that is included in the scope and the limitation. Okay? So I think since I click man good na ko ang formulating the research title, I think I skipped this one, selecting the problem, which is actually the first step. So when you're going to select the problem class, please take note of the following. We also abbreviate it as problem. So number 1, propriety. Yung research problem nyo ba appropriate sa field ninyo? Pharmacy related ba yan? And at the same time, yung gagawin nyo ba is appropriate for the needs of the community or your target respondent? And then relevance. Syempre, it has to be relevant nowadays. Baka yung pag-aaralan nyo ay nangyari na sa una and no longer relevant na siya sa kung what is our situation nowadays. And then originality, please take note that we don't accept duplication of studies, okay? So kung example, na pag-aralan na si rambutan as blood sugar lowering last year, then wala nang magkakandak ng study na magkapareho. If you are going to do a blood sugar lowering na study, then please look for another plant material. Or if you are going to use rambutan leaves, then look for another pharmacologic activity. It might be anti-hyperlipidemic, anti-inflam, but as long as do not duplicate or do not do the same studies that are already done, especially sa school. Okay, and then benefits, actually benefits and essentiality, medyo related sila, no? So we have a part in our research paper called significance of the study. That is where we establish the urgency to conduct the study. Why do we need to conduct this study? Why? Bakit ngayon natin siya sa studyhan? Urgent ba siya? So kailangan ba natin siya that it will really give benefit to the community or to the school or to whoever is ang beneficiary ng study or ng result ng study natin. Okay? And then we have legality. So we have to follow class rules, laws, and even ethical guidelines in the conduct of research. When we are going to do drug discovery research, you have to take note that we don't do the experimentation directly to human subjects. Okay? We start with the animals, but do not forget that animals also have rights. So as much as possible, we limit the pain na mafe-feel nila during the experimentation, the discomfort, and we only do euthanasia if ever we induce a certain disease or condition to them. So just like sa present ko na study a while ago, blood sugar lowering of the rambutan, leaves extract, kalimutan yung title nila, to alloxan-induced diabetic Swiss albino mice. So actually, after they did their experiment, they really euthanized their Swiss albino mice kasi nga ginawa nila yung diabetic. Ang ginamit nila, alloxan, it's a chemical substance that will destroy the pancreas so that it will not release insulin anymore, thus making the mice diabetic. So may sakit na kasi talaga yung mga daga nila, kaya after the research, nag-euthanasia. Pero again, hindi lahat ng experimental study sasagawa ng euthanasia class. And measurability. Do not forget na you are going to conduct, especially class quantitative research. Kailangan ma-measure talaga natin yung desired outcome natin. Yung dependent variable should always be measurable. So when you say problem, it's the centerpiece class of a scientific study, a scientific inquiry. So this should be specific. And kailangan at the end of the study, we should be able to address this problem or to answer or give a solution to this problem. So what are the guidelines on assessing the problem? Nasabi ko na to kanina, novelty, meaning your study should be original. It's not a duplication of an existing study, especially if the same place. Okay? So for example, may nag-conduct ng blood sugar lowering activity ng mangga doon sa India. Gusto mo din mag-conduct dito. That is class acceptable kasi hindi naman the same place. Okay? And actually, magkaiba naman yung composition ng mangga doon sa India dito sa atin. Meron yan, hindi kasi standardized. Yung soil type can affect phytochemicals ng ating mga plants. So it is accepted. Pero kung as in the same, no, the same institution, the same lahat, yun yung hindi natin tatanggapin. And then capability of the researcher. So I hope na ang mga napili niyo dyan na study, capable kayong lahat na matapos yan. You have the knowledge, enough knowledge to do that. If ever hindi naman, your advisors will guide you. Okay? Example, ako yung magiging advisor ninyo. I will guide you how to do the experiment, for example, how to handle the mice. I will help you with that. Okay? And then usefulness of the study. Hindi tayo magkakonduct ng research for the sake na makagraduate kayo. Our goal is to help solve a certain problem and to add up to the body of knowledge. And then availability of data and information, especially for like descriptive research or mga qualitative research. Mahirapan tayo class if our respondents are not really accessible Nahirapan tayo during the data gathering. Cost and time limit of the researcher. So isa pa yan na kailangan yung bigyan ng konsiderasyon. Your time, meron ba tayong time mag-conduct ng research? Yes, bibigyan talaga natin yan ng time. But the cost class, that's the downside of doing an experimental research because you will really spend a lot of money for this. So ang ilaga pa lang daan, the mice, I think nasa 180 na ang isa. Kasi we are not using the ordinary mice that we can buy from pet shops. In research class, especially for drug discovery, we also have to consider the genetic material, the genetic makeup of the the albino mice or the mice. So kailangan natin gumamit ng yung daga na isang breed lang talaga, and at the same time they come from the same family. Okay? So ito yung formulating the research title. Do you have questions so far? Do you want to clarify something? May gusto kayong i-clarify pa? Wala, sure na yun. Hindi lang, ha? Hindi sila pwede hindi pwede, Patricia. After using that sa Picol, ang gamitin kasi natin sa Picol kay coming from pet shops, no, tuwingon ko sa inyo ka ng tag-20 lang. Legit na siya pwede gamitin sa research. Okay? Kasi we are not doing research for the sake of doing research only. We are doing that para may ambag tayo sa community. So, we really have to consider genetic variations. Diba? Yung, wala pa kasi kayong pharmacology, no? Or wala pa kayong like subjects talaga that is really talking about drugs. Yung drugs kasi natin, class, may talaga, influence yung genetic makeup. So, meron tayong drugs na effective doon sa isang race and meron ding hindi effective sa atin. Or yung dose, for example, kailangan ng malaking dose sa atin tapos konti lang sa kanila. Example, yung mga Caucasians, mga puti, especially the isoniazid that is given for patients with TB. Yung ating dose dito sa Philippines is medyo malaki. Ay, choppy kay nag-unstable akong connection sa muna akong problem with your class because I cannot go home. Okay lang sana kung nasa bahay ako. Pero I can't really go home, no? Munang nag-struggle ko sa connection dito sa school. Muna mag-choppy. Pag mag-choppying na ko ha, para ma-clarify na to. Unsa na ito? Ang genetic variations class, ang isoniazid, mas malaki yung dose natin dito kesa sa mga Caucasians. Kasi mas efficient, mas grabe tayo mag-metabolize ng isoniazid. Our genetic makeup class as Filipinos or as Asians, mas matindi tayong mag-metabolize ng isoniazid na ma-metabolize agad natin siya. So, madaling ma-excrete compared to Caucasians na the drugs stay longer in their body since slow sila mag-metabolize, and that means nilo-lower yung dose sa kanila. Okay? Questions pa? Okay? Wala na? Sure na yun. Okay, so if you're going to make your title page, do not forget class na if your title is medyo mahaba, more than one line, it should be arranged in an inverted pyramid na format. It should be bold and at the same time inverted pyramid. So kung mahaba ang title nyo, napuno na yung isang linya, you really have to arrange that one. Putulin nyo siya na magiging like inverted pyramid siya. That is just for formatting. So this is just a minor thing. However, you need to follow this also. Okay. Next, research documentation. When we are going to document research, we are going to use these two formats, the APA, American Psychological Association format, and the MLA, Modern Language Association na format. But sa school, actually, mas ginagamit talaga si APA. So I will teach you also how to do that. Yung APA format, ituturo ko yan sa inyo. Okay? But before ako mag-move on sa topic ko, how working bibliography, kasi this is more on the research proper na kasi talaga, mag-skip muna ako. Research design muna tayo. When you say research design, it's the plan or your overall plan or pattern that you are going to do sa research ninyo. And this will actually help you decide what procedure are you going to use. Okay? So, yung research method, ito naman yung step-by-step procedure na susundin natin to gather your data. And that also includes the interpretation and the analysis of your data. So we have two categories of research methods. Ito yung pwede niyong pagpilian, class, as you propose a certain topic or title. Pwede kayong mag-conduct ng qualitative research or pwede kayong mag-conduct ng quantitative. Pag sinabing qualitative, this is data free. You don't have a numerical data here. Okay? I hope that is clear. Pag qualitative, no numerical data. Therefore, this is a product of interviews only and actual observation. So, sinusulat lang talaga natin yung results nito. Okay? Now, ginagamit din natin ang qualitative method if the researchers the data from our research are from non-probability samples. When you say non-probability, parang na-lesson ko ito sa inyo sa statistics. Diba? Pinadifferentiate ko pa ito sa inyo. When you say non-probability, we are not giving the members of the population an equal chance to be selected in the study. Therefore, example, you're going to conduct an interview, you can actually select the people that you are going to interview. So, example, kanilang ako interview kay kaila ko ani Seya ha. Or kanilang ako i-interview kay available siya karon. You are not giving an equal chance to all the members of the population to be included in your study. And at the same time, when you're going to do a qualitative research, we do not seek generalization here, especially for like phenomenological research, example, experiences, and historical research. Okay? So for example, you're talking about experiences. Experience niya sa ganitong situation. Tinanong mo siya, ito yung experience niya. Okay? Hindi mo yun ma-generalize for all people kasi siya lang yung may experience nun. Okay? Example, experience niya sa pandemic. Hindi naman tayo pare-parehas ng experience, right? So we cannot generalize. And at the same time sa history, merong nangyaring history ganito. Nag-ask tayo sa isang person, sabi niya hindi maganda yung experience niya in that situation. Tapos nag-ask ka ng another person, maganda naman. Ganun yung sabi niya. So that's the thing. We cannot generalize if we are going to conduct a qualitative research. We are just presenting the data na collect natin. Ganon. And we do not do interference with the characteristics of the population. Ganun pa rin, hindi tayo makabigay ng conclusion. Hindi natin masabi na yung residents ng General Santos City, maganda yung experience nila during that time. Hindi natin yun masabi when we conduct a qualitative research. However, this is still an accepted research design. Importante pa rin ito na research design. Example sa history books natin, wala tayong history books if hindi tayo nag-conduct ng qualitative research. Hindi nagtanong yung mga researcher sa mga people with first-hand experience over that history. Okay? So what are the special kinds of researches? Pwede kayong mag-conduct ng ethnographic research wherein you, example, observe a certain group of people. It's not necessarily a tribe, yung mga tribal people natin, as long as it's a group of people, class, na i-observe natin and we observe or we interview them about their traditions and their customs. For example, punta tayo dun sa, sa bukid, and meron tayong group of people doon, tribe, and then we ask them how do they diagnose a certain disease or paano nila yun ginagamot. So isusulat lang natin yun. Wala tayong numerical data, kaya under siya sa qualitative research. That is also true for phenomenological research. When you say phenomenological research, that is talking about experience. So if you encounter a study with a title, Lived Experiences of Pharmacists Working During the Pandemic, that is a phenomenological research. So kasi sabi ko kanina, experiences cannot be quantified. And then appreciative inquiry. From the name itself, appreciative inquiry, most likely our questions here during the interview are the good things. Example, good things in an organization. Example, you want to ask students here in Jensen Doctors, what are the good things here sa institution natin? That's appreciative inquiry. And historical research, as nasabi ko na kanina, na we can interview people with first-hand experience of a certain historical happening. That's historical research. That is a qualitative research because we cannot quantify what happened in the past. Okay? So what's the advantage of doing this thing? This research? Hindi kayo gagastos ng malaki kasi you will be just doing an interview. And kung okay ang interview skills ninyo, hindi ito mahirap gawin. What's the thing na medyo mahirap with this study? Marami kayong isusulat. So kung titingnan nyo sa library class, yung mga makakapal na study sa library, mga qualitative research yon. Again, marami kayong isusulat kasi lahat ng sasabihin nila isusulat ninyo. And you're going to give meanings to their words. Okay, you will also write from their words. You are also going to write what do they mean with their answers. Okay, do you have questions? Baka may nagbalak kasing may nagbalak na mag-conduct nito. Sige, mag-sync in muna ha. Wait lang. Recording. Okay, so sa quantitative methods class, all research na merong numerical data will be under here, and we can use all types of sampling techniques. Please have a review of the different sampling techniques I taught you sa statistics. The probability and the non-probability sampling techniques can be used sa quantitative methods, though we usually use the probability samples, okay? And unlike our qualitative research, we seek generalization here. After getting the numerical data, we make a conclusion, we infer the characteristic of the population, example for the case of their knowledge over a certain topic. At the end of the research, we make a conclusion whether they have high knowledge, low knowledge of that thing or of that situation or topic class. Okay, now what are the examples or the types of research design under the quantitative methods? You can do descriptive methods. So from the name itself, descriptive, our aim is to describe, okay, the population, the phenomenon, and we can use numbers here using our questionnaire. And you can also do experimental research. So we have a lot of experimental research class sa school. So ito yung mga studies na pwede nyong i-explore. So, tinapos ko lang talaga siya.